Good morning, everyone. Welcome to our 18th BC Poultry Symposium webinar. And today I'm very honored to announce that we have a very great speaker, Dr. Kevin Amini from Boehringer Ingelheim Animal Health Canada, to join us to talk about commercial poultry serology. I have known Kevin for a couple of years, and he has always been very generous in terms of sharing his experience and knowledge. And whenever he finds useful resources, he always email them and share them with me. And Kevin's he has extensive experience in poultry medicine. He started his poultry medicine practice privately for 5 years after graduation from vet school. And then he also completed a 1-year postgraduate program in poultry management system and nutrition in the Netherlands. He then completed a master's degree in poultry nutrition at McGill University, followed by a 2-year Master of Veterinarian Science program in poultry medicine and pathology. And he also did a 1-year senior residency in avian pathology at the Western College of Veterinary Medicine in the University of Saskatchewan. So he did obtain his board certification exam of the American College of Poultry Veterinarian and worked for CFIA for 4 years. Now he has been with Boehringer Ingelheim as a technical service veterinarian since 2017. So without further ado, let us welcome Dr. Kevin Amini. He's going to talk about commercial poultry serology. Thank you, Kevin.
Thank you very much, Gigi, for kind words. And it has always been mutual with you sharing your field experiences and your knowledge with everybody, including myself. I always think a lot of things to learn from you. So I will try to share my screen. I have a lot of slides, and I will. Do you see the slides?
Yes, we do.
Yes, we do.
Okay.
Yeah.
Perfect. Thanks for the invitation. I appreciate the opportunity to talk here. Before I get started, I want to thank a few colleagues that were generous and gracious enough to allow me share some of the data in this slide set, namely Dr. Vicky Bowes from BC Department of Agriculture at the lab, Dr. Emily Martin at AHL lab at University of Guelph, and Dr. Mike Petrick at McKinley Hatchery. They have generously allowed me to use some of their data in this slide set. And also some information come from serology kit providing companies, namely BioCheck and IDEX. They are big players in the field with lots of experience on the poultry serology as well as other diagnostic tools. So they are great. Their contribution is greatly appreciated as well. So I have too many slides. I was telling Gigi, I just hid a few slides just for the sake of saving time. We're talking about immunity system of the chickens. They have primary organs, and they have, as you know, peripheral lymphoid organs. Each of them have important components. For primary organs, thymus gland, giving rise to T cells, T lymphocytes is one of the important ones, being a big initiator or source of cell-mediated immunity, or CMI, booster of Fabricius, giving rise to B cells. The same with the bone marrow and yolk sac with the maternal immunity. And with the peripheral lymphoid tissues, would be Harderian gland, cecal gland, spleen, and gut-associated lymphoid tissue, which can consider, if you call it peripheral lymphoid tissue, it's probably going to be a misnomer because it's the largest lymphoid organ in the body of the bird. And there is also respiratory related respiratory associated lymphoid organs that I didn't put it on this slide. So what we are looking with serology is essentially there are different components and different subgroups to immunity system of the birds, or they put them under different subgroups, but under different components of it, which are cell-mediated immunity or CMI antibodies or humoral immunity and memory cells. With serology, we are only looking at antibody or humoral immunity produced by B lymphocytes. And Dr. McPatrick at McKinney allowed me to use this slide. This slide can be used, it is both for, applies for both chickens and for mammalians. But this is, if you consider this, the whole immune system of the bird with cellular components, with cytokines, with everything. Cell-mediated immunity is everything else, and cytokines and everything, but humoral immunity is only this part. So plasma cells which give rise to B lymphocytes which produce antibodies or glycoproteins. So essentially when we look at only, because it's easier to quantify the humoral immunity, if we look at only antibodies, we are losing the whole picture. Of course, there are diseases, for example, let's say infectious bursal disease, Gumboro, or with avian encephalomyelitis. Humoral immunity is very important in this kind of diseases, more important than the cell-mediated immunity. But in diseases like, let's say, infectious bronchitis, if we just focus on systemic humoral immunity, we are losing the whole pictures, because a very important component of the immunity in the bird against this pathogen, infectious bronchitis, would be local immunity, which is majority of which is cell immunity, but also partly IgA. But we shouldn't essentially focus the big pictures. But in the field, we are used to, because numbers are easily to show and demonstrate, we tend to focus only on titers and not on cell-mediated immunity. There are ways in the laboratory, on the research setting, to measure cell-mediated immunity, let's say flow cytometry and blah blah. But these are not practical in the field, and they are too expensive. They can only be used in the research setting. Also for diagnostics, we shouldn't, there are other tools other than serology. Serology is only one of the tools that we can use for proper diagnosis. We shouldn't lose the whole picture, and there are many other tools in the toolbox that we can take advantage of. These are two basics, just a basic definition of what is antibody and antigen giving rise to antibodies, and illustrations of what we are talking about when we are talking about IBV, for example. If it's coated by antibody, it cannot attach itself, as an example, to the lining of the trachea, and essentially by IgA, and then essentially it will help in eliminating the virus, or not letting it enter the body. There are different components to or different types of immunoglobulins in the body of both mammalians and chickens, the most important of which are IgY, which is in mammalian is called IgG, and IgM, which is a pentamer. But there are also other ones like IgA, which is important for mucosal surface immunity, IgG in anaphylactic reactions, and IgD, which is existent and non-existent in some types of birds, but existent in some other types of the birds. They are more important in mammalians, and they are very small. What the most important components of, or the most important types of immunoglobulins for humoral systemic immunity are IgY and IgM. This is just an example of antigen from infectious bursal disease virus, viral protein 2 antigen. Is from a paper from Cell, just illustrated of if you do PCR and with biomolecular techniques, and we decipher the VP2 antigen of the virus, and if we open up essentially the virus, that's how it looks like, and it has different components, which is more of interest to molecular biologists, not me. I would say. But also, as an example, like this VP2 protein, it has, they call it hypervariable loops, which is what is essentially immunogenic for the bird. And this is not going to be the focus of this talk anyways. But what I want to more talk about is immunity system of the birds has common function in two different demonstration in two different ways. One is primary and the secondary. So we use the primary as it's shown on this graph here from BioCheck. Primary, essentially, we consider it as first vaccination. And when the vaccination is done, we see a response both in terms of IgM and IgG. And the secondary antigen exposure is either field exposure with the same type of antigen or the secondary vaccine of the same type. And the secondary response is usually humoral response is much more component or much more elevated as compared to the primary one. Not only that, but also the interval after the exposure to the response is going to be much shorter as a result of the memory cells. What is important here to note is also that with ELISA test, we only measure IgG and not the IgM. For this would be the focus of this talk, essentially, measuring the level of IgG, which is shown in serology reports that we receive from the lab. There are different ways to sample for serology, blood sample for serology. Different techniques are there, but essentially the most common technique is doing it through the brachial vein with the chickens and putting the blood sample either in the Eppendorf tube or in the red top tubes with no anticoagulant, and then waiting for putting in an upright position for 1 or 2 hours, separating the serum, and either sending the fresh serum to the lab if we are sending it right away, or freezing them in the freezer and then sending them to the lab. Dr. Emily Martin from University of Guelph, AHL lab, she allowed me to use these slides, what they require when we submit the samples. It's at least as a bare minimum, the requisition form should contain information on age, on commodity of the birds that you're using, and a detailed history of what we are looking for, what the clinical signs are, what the necropsy findings are, and everything that is relevant to the case, as well as what is required, we required the lab to do for us. So these are the bare minimum that the lab requires when we are submitting a sample. And also each lab has its own packaging and shipping guidelines that they provide, and it's on their website. And as a it's obvious just to say that blood samples should always be separated from the tissues, and because they're always being serology samples are sent to a different part of the lab as compared to the tissues when we are sending tissue and serum samples together, and that's usually the case. And also, there are certain requirements for shipping the samples. For example, watertight inner packaging surrounded by absorbent material, or watertight secondary inner packaging, or sturdy outer packaging. That should be, it's also under the instructions that also come from the lab. And this is what the lab doesn't want to see. Essentially putting requisition form together with the samples and not using tubes that close properly, and everything becomes a mess. So different types of serological tests are usually used in the labs. The focus on this top and the type of test that is usually used in the field is ELISA test, enzyme link immunosorbent assay. It's used for IBD, NDV, Newcastle disease, bronchitis, reovirus, chicken virus, laryngotracheitis, avian encephalomyelitis, myelitis, and mycoplasma gallisepticum or synovial. But there are also other tests that are used, but they are usually either used as a secondary test for confirmation of ELISA test, or they are used in the research setting and not in a diagnostic setting. These are plate tests, serum plate agglutination tests used for mycoplasma gallisepticum and synovial, or hemagglutination inhibition test. It's used for bronchitis, Newcastle disease, for mycoplasma gallisepticum and synovial, virus neutralization test for several different viruses. And there are also tests that are usually almost always used in research settings and not as a diagnostic tools because of practicality and expense. Agar gel immunodiffusion, complement fixation test, and immunofluorescent assay. Talking about ELISA test, which is the focus of this talk, it's an automated system nowadays, since many years ago actually, and it's in this test, antigen-coated test plates capture specific antibodies in a diluted serum sample, and the reagents turn the shades of the blue depending on the amount of antibody present, and then these shades of blue are read by by spectrophotometry machine, and the result is reported as histograms as a graph by the machine. Not only for monitoring pathogens, but also for peptides, for proteins, for antibodies, and for hormones, these ELISA tests can be used. And again, I left this slide here, just it shows the difference in the plates. Both tests, hemagglutination inhibition test and ELISA test, both use plates, but here, this is how the ELISA plate looks like, and hemagglutination inhibition test essentially detects how much the pathogen, which is supposed to be agglutinating or coagulating the red blood cells, works in terms of doing its job, which is the coagulation of a red blood cells. So by diluting different levels of serum containing this inhibiting factors, which is antibody, inhibiting the hemagglutination, we see, for example, here, let's say a 512 titer, it has almost stopped the hemagglutination process, and this would be the reading for this test. What we use, serological monitoring, it could be either for vaccination monitoring, that's what it's usually used, either to find out whether the vaccination has been done properly, or the maternal antibodies that the broilers have received has been at the adequate levels, or whether, if you are using it for diagnostics, whether there has been any field challenge. And for this purpose, the samples should be submitted in pairs. Essentially, at the onset of diagnosis of any problem in the farm, we submit a sample to the lab, or if we take a sample, and about 2 weeks to 3 weeks later, we collect some convalescent samples and we send that to the lab. And an elevated second convalescent samples, elevated titer, would be indicated of a presence of a pathogen. As a rule of thumb, let's say with the IPV, a 4-fold increase in the titers would be indicative of a presence of a pathogen in the field. And for vaccination monitoring, when we use the process, so serology for vaccination monitoring is for to make sure the quality of vaccine is good, whether this cold chain or the efficacy or the type of the vaccine or the vaccination preparation or mixing has been properly done. The birds have received an adequate level of antigen for immunogenicity. Quality of vaccine administration, whether the vaccines, when, let's say, for example, we are talking about the inactivated kill vaccine, whether the birds have received the vaccine uniformity and how the vaccine take has been, if the birds have had any sign of immunosuppression. In long-lived birds, persistence of immunity or titers over time, and also with really seriously elevated titers, we can find out if we have good baseline, solid baseline, we can find out, I'm going to talk about that later, we can find out the presence of a field challenge concurrent with the vaccination as well. This was done by comparing to the baselines. And when we don't use serology for vaccination, it can be used for disease monitoring, as I mentioned in the previous slide, and I will show it in the upcoming slides as well, with the diagnosis of field infection, with confirmation of negative status of the flock. And this is very important with the SPF-specific pathogen-free flocks, the flocks that are used for, let's say, for example, in research or in vaccine production. We need to make sure that they are pathogen-free, and also for monitoring absence or making sure the foreign pathogen, foreign animal diseases or foreign pathogens are absent in the field, and also can be used for epidemiological studies as well. So what the vaccination monitoring can show would be failure to maintain. These are just examples of it. The failure to maintain cold chain, problem with the vaccine mixing, missed birds during mass application, let's say by spray or drinking water vaccination, poor quality of administration, for example, with inactivated vaccine to each bird. And when we have an answer, and we do our investigation and find out with the possible cause, we can address that with a certain action plan. For example, if there is a lack of uniformity in the vaccine application, which will be showing by high coefficient of variation value, I'm going to talk about this later, then it will show that probably it's a problem with the vaccine administration rather than the vaccine itself. So then the issue should be addressed accordingly. Also, some serology kit providers, they also provide a calculator with whether how much return on investment following vaccination the company can take advantage of in order not to over-vaccinate and not to under-vaccinate. There are important factors to consider when we try to have accurate results and also accurate interpretation of serology results. There are good quality samples by the proper technique and shipping and transportation, proper sample size, proper sample timing, sample frequency, frequent validation of test procedures by the lab, and the history that accompanying the samples, and as mentioned in the previous slides. And this whole thing is just to make sure that when we prepare our baseline and we compare our results to a baseline, the data are well established and they are interpreted properly and appropriately. One important point that I shouldn't forget to say is that pooling samples from multiple birds, even if it's practice, and it's usually in case of broilers, it's really hard to, especially in younger broilers, to get birds from each samples, just not to damage the birds. Pooling samples from several birds reduces the test sensitivity by dilution. So with the sample size, obviously the higher the number of samples, the better, the more accurate would be the results. But usually in the field, the samples are compromised between the correct number and the cost of sample taking and analysis. BioCheck did a very interesting study, and they demonstrated that the optimum number of samples or minimum number of samples that they recommend in the field to be taken from the chickens, it is at least 23 samples. In this study, they to find out the optimum sample size for establishing the baseline, and I'm going to come to that later. They sampled 100 individual serum samples from the old chickens and tested them by IBD ELISA kit, by their own IBD ELISA kit. in this example, the material antibody titer was shown to be, mean material antibody titer was shown to be, in this DIAGNOSTIC, to be 4,057. And the coefficient of variation, or the deviation from the mean, was determined to be 48%. And they also, by the Venter formula, they determined the predicted days to vaccination to be 19 to 21 days. So, and then after that, they subdivided the samples randomly to the group of 46 samples per group, 30 samples per group, 23, 15, 10, and 5. And they repeated the same process of subdividing the samples for 16 times. And they found out that when, let's say, we lower the number of the samples from 46 to 23, there is not much. I mean, of course, there is increase in terms of range when we decrease the number of the samples per each subgroup. The range increases by size, and this is not what we want to see. But when we decrease the number from 46 to 23, the change is negligible. And the same is with the coefficient of variation and with the days to vaccination. The change, or the widening of the range, would be minimal. And they did the same thing with they also looked at mean titer in terms of percentage within the range of the mean, plus minus 20%, and percentage of the samples with the difference from the mean when we look at the days to vaccination, plus minus day 1. And they saw the same, the optimum numbers, it's 23. So they recommend 23 for establishing the baseline, the minimum number of the samples to be at least 23 samples. But after that, after this baseline in our farm has been established, and we know our farm essentially, our barn essentially better, then the number can be dropped to 15 samples per submission. But I've also seen 18 samples per submission from BioCheck as well. So this would be after that, but this won't be the most, it would detect essentially the most common titer groups, but it's essentially is insufficient for quantitative analysis. So when what BioCheck recommends essentially is, let's say we are talking about birds on the litter. If you have a house which is usually rectangular, if each diagonal of the house is let's say 60 meters, every 5 meters sampling one bird, so 12 samples for this diagonal and 12 samples for this diagonal would be 23 to 24 samples. Or if you have a sample with the diagonal length would be 72 every 6 meters, and so on and so on. Essentially, we make sure that all the birds randomly throughout the farm have been sampled, throughout the barn have been sampled, and we have random sampling essentially. And the same would be done for the cage layers, numbering the cages, and then picking up numbers from, let's say, 1 to 10. If let's say we have 1 to 102 cages here in this picture, we have many, but let's say we have 102 cages, every 10 samples, picking up 1 random sample. Essentially what we are doing, I just put these hypothetical lines here. If there is a problem with the water lines, let's say there is a biofilm buildup, or there is a problem with the water lines and the birds on this side of the barn or this part of the cages, they have low water pressure. If you only vaccinate, if you only sample these birds or these birds, we will say no, none of the birds have received proper vaccine, right, or they have been properly vaccinated. And the same, if we only sample this area, then we would say no, all the birds have been vaccinated properly. Essentially, randomization is very important. And all this I talked about is about monitoring, vaccination monitoring. If we use serology, according to BioCheck, for diagnosing pathogens in the field, there is a different table that is used. essentially they have created this table for diagnosing or finding a pathogen with 95% certainty. If, let's say, our flock is 5,000 to 10,000 birds, which is usually the case, to pick up 10% infection rate, we need to do at least 28 samples. Or if the infection rate is 2%, we have to sample at least 147, which doesn't look very practical. But what I showed in the previous slide is only for vaccination monitoring, not for pathogen diagnosis or finding pathogens in the field. Other important factors to consider for proper interpretation of the results or sample frequency. In broilers, the sampling should be done, what is usually practiced, especially in Europe, they do for diseases like, let's say, Gumboro IBD, they do sampling in the first 3 days of life, preferably first day of life for maternal antibodies, and then they do sampling at slaughter, for which will detect the presence or absence of challenge in the field and quality of the vaccination and the persistence of vaccination. And in breeders and layers, live living birds, the sampling the same with the maternal antibody in the first day of life, preferably, or throughout the life of the chicken, which will show persistence and field challenge. And in this case, in long-living birds, we need at least 3 times sampling, and preferably, which is usually the case, the sampling is done more frequently. And these 3 times would be just before the inactivated vaccine to show the quality of the prime, live prime, and any field exposure. Or and the second one would be 5 to 8 weeks after the inactivated vaccine, usually 5 weeks, and after the onset of egg laying and at the end of the lay to show the tighter persistent. And one more point to remember, that if the sampling is done, let's say every time for the establishing of the baselines, 5 weeks after the vaccination, the same process should happen every day. We cannot switch to, let's say, 8 weeks after vaccination. The same pattern of sampling with the timing should happen every time in order to establish more reliable baselines. This is a graph from BioCheck. It shows us importance of live prime plus kill vaccine, the practice that is done in breeders and layers. Essentially, when we do both live prime and kill vaccine, first we do live prime and then kill vaccine. Not only as a secondary immunity, it boosts the titers. Also, it keeps the titers persistent over time. But if you only do live vaccination, the titers, they increase a little bit, but after doing the live vaccination for the second time, there is not much increase. And not only that, it's also not persistent. When we only do kill vaccination in both times, this must be kill vaccination, I'm sorry, or poor priming, essentially. Only kill vaccination in both cases. Then we only see the increase. Maybe the titers look as good as when we do live prime plus kill, but the titers wouldn't be persistent over time. So it essentially shows the importance of doing live prime before kill vaccine for breeders and layers. And one important thing to consider when we're interpreting the results, there's the vaccination route. This is a study that European vaccine, European bronchitis vaccine was used by different routes, and different routes with the same vaccine produce different titers. So essentially, if we are making a change, if we are establishing the baseline, we should stick to the same route of vaccination. After the baseline are established, then if we change the vaccination, we should expect changes, and then we can compare it to our baseline. And with the same, another study with the BioCheck, they looked at samples over time, the Newcastle disease samples over time. In some countries, the live Newcastle vaccination is done really early. They did it here at 1 day of age and 14 days of age. In the case that the vaccination was done by course spray, the titers were much higher than drinking water. Essentially, it depends on the type of pathogen we are talking about. If we are talking about the respiratory pathogen like IBV, bronchitis, or Newcastle disease, the respiratory pathogen, in those cases, because they function through respiratory tract, the course spray would yield higher titers. If you are talking with the diseases like Gumboro disease with IBD vaccination, if the vaccine is used by drinking water, I'm talking about live vaccination, because they function through gastrointestinal tract, the titers would be higher. But also that depends on many other factors, including, for example, the quality of water or the quality of drinking water the birds receive, or quality of the spray or uniformity that the birds receive. So there are also many other factors involved. Also, timing of vaccination and the type of the vaccine. What type of vaccine we are talking about. If you are talking about live, let's say talk about IBD vaccines, Gumboro vaccines. If we give IBD live vaccines, we have to be very careful about the time of the vaccination in the field, live vaccination, because if we wait long enough for the maternal antibody or the passive immunity to diminish, it may cause immunity gap after a certain age and if the maternal antibodies, if the live vaccination in the field is given too late, or if it's given too early, maternal antibody can neutralize at least partly the vaccine, and then it would be a waste. So we have to be very careful when we use live IBD vaccination in the field, for example, and when we sample. With live IBD vaccination, for example, we need it's a regular practice in European companies to sample day-old chicks, and based on that, using a formula called the Deventer formula to decide what the appropriate age for field vaccination or IBDs. But if you are using a vector vaccine like VACCINATION at the hatchery in Novo, these vaccines, they work independently from maternal antibody. So by 12 days of age, we get sufficient immunity to protect the birds, so there would be no worry and there is no need to sample the birds for serology at 1 day of age, because they work independently from maternal antibody, and they are used in Novo in case of broilers at the hatchery or with layers at 1 day of age by subcutaneous route. And the timing of sampling, as a rule of thumb, for live vaccine, the sampling is done about 3 to 5 weeks after live vaccine, and with inactivated vaccine is done about 5 to 8 weeks after the sampling should happen after the vaccination. But again, as I mentioned, we should stick with the same timing or same interval for establishing the baseline. If we are always sampling 5 weeks after inactivated vaccine, we always have to follow the same interval. And after that, the purpose of all this is essentially to establish our baselines, and our baselines. This is a demonstration of one for IBV, for bronchitis, provided by IDEX labs. Serology kit providers, they have their own baseline. They suggest on their manual to the producers. And one important thing that we should remember is that when we submit the samples to the lab, we always have to ask them what kind of test or what kit has been used, and for establishing our baseline, then later on also stick with the same ELISA kit, because ELISA kits, the results from ELISA kits from different companies are not comparable usually. So for IBV, for example, baseline, we would, after collecting data for many months or years, we will have a range for high titers, a range for medium titers, and a range for low titers. And then this is just a starting point. We use the suggestions from serology kit providing companies to establish our own baseline, and that's the final purpose we want to get to, because our baseline that we create will depend on many factors that would be probably different from this baseline that is suggested by these companies. According to changing by the factors like location, type of bird, age of the birds, seasonality, and vaccination programs and everything. Essentially, where we want to get to is essentially establishing our own serology baselines. This is, for example, a baseline that is suggested by IDEXX lab for broilers and breeders, and they always tell you what the baseline is established based upon. For example, this table is based upon using two live priming and one inactivated boosting vaccine, giving the titer ranges expected for breeders and also for the progeny, for day-old chicks. And after the baseline established, when we want to do any modification, it's preferable, or if it's possible, we should do one change at a time. For example, to make sure that to find out what the change in the serology as a result of our change in management or vaccination has been. For example, whether there was a change in vaccination program, in the type of the vaccine, in vaccine administration method, vaccination time, and other factors. And again, for example, IDEXX has worked with in the state of Georgia, has worked with Georgia Poultry Lab, and they have created a baseline for ELISA serology, a regional baseline for ELISA serology for different type of diseases for broilers and breeders. I have to go to the next slide, sorry. What I want to show you, I will show you later on, but what I want to show you is these baselines essentially are a starting point for our own data to be compared to, for our own baselines, essentially. Not only IDEXX, but also other serology kit providers, they also provide their own baselines for different pathogens and for different scenarios, for different vaccines, for example, also for different types of the birds, whether being for broilers, they suggest a mean titer range and a certain limits above which it would indicate the presence of infection in the field. And they do the same for IBD, being I call it a humoral disease, because the humoral immunity is very important with IBD. They provide more detailed baselines, and they do the same thing with the layers and breeders for different pathogens. Here and here, there are examples of it. You can see there, and you can ask your lab to provide it to you. And essentially, what baseline does, it helps us with, after the baselines are established, it shows us trends. Not only it shows us trends, but also it helps us to anticipate outbreaks and to find out about concurrent trends. For example, in this graph, you will see they put together the bronchitis serum serology results, and they put it together with the condemnation in the broilers as a result of AirSac, presence of AirSac condemnation in the processing plant, essentially. And here, in many different points, increased serology titers, it's concurrent with increased condemnation. And this kind of data essentially is very useful for especially large integrator to come up with to later on take proper steps for to mitigate the issue. So, and also not only that, some of these serology kit providers, they also provide softwares that can help the producer to come up with the numbers showing the return on investment after vaccination and biosecurity programs, to essentially show that essentially we are doing proper vaccination and we are not under or over vaccinating the birds. The same examples when I showed the serology titers can be put here with broiler breeders. The IB bronchitis serology, the serum titers has been put together with the hatchability and egg production rates to see if show if there are any concurrent trends. And the same has been done here with the avian encephalomyelitis titers in broiler breeders, and the titers have been put together on the same graph with the egg production percentage and hatchability to find out whether there are any trends. Maybe it's a little bit late to show it in this slide set, but basic things that we see in a serology report are mean titers, which shows how much antibody is in the system of the bird. Uniformity of titers shown by coefficient of variation, how much deviation is from the mean, percentage of the positive birds, which shows the vaccine take, and the persistence of response, which shows the mean titer response over time, especially in breeders and layers. When we talk about mean titers, titers are usually, with ELISA titers, are usually between 0 to 20,000, but I have seen higher numbers than this as well. And again, it's overgeneralization maybe here. But in a report that you are receiving, we usually put that, in one section, you usually see the titers put in titer group. For example, in this case, they have sampled, I think, 12 chickens, and then they put the number of samples in each titer group has been put in under different bar. And what it's important not to overinterpret this. I usually use these titer groups to first show that there have been if there have been any seronegative birds or any birds that have not converted in terms of serology. And also to show how dispersed are the data, or how tight the data are, the titers are. Because if we look at only these titer groups, you may lose sensitivity. And the reason is that if, let's say, titer group 10, it shows from 9,000 to 10,000, or 8,000 to 10,000, and we have 7,999, it will fall under titer group 9 and not 10. So essentially, we lose sensitivity here. This is good for finding out whether there are, as I mentioned, whether there are any missed birds or any birds with which have not seroconverted, and how tight the titers are in terms of dispersion. This is a nice slide I received from Dr. Boas. Essentially shows what if we vaccinate and we see a lot of samples, a lot of titers in lower titer groups, then we have probably had a problem with vaccination. This is what we prefer to see in the field after vaccination, that the data are very tight in only two titer groups, and show higher titers. And this is probably as an indicative of infection in the field. When the data are more, or the titers are more dispersed, and they are on the higher range. And again, these are the rules of thumbs. But if we sample 10 birds with Newcastle disease, we want to see 8 out of 10 birds to be in titer groups higher than 7, with IBD, with titer groups higher than 8, with IBV higher than 6, with reovirus higher than 5, with avian encephalomyelitis higher than 4. Again, all these data, I forgot to mention in the beginning, when the interpretation of data should be done in collaboration and with the help of your veterinarian. Please, I would recommend not to interpret the data on your own if you are a producer, because that would easily result in over or under evaluation of the titers or the data that you receive from the lab. So this is what we prefer not to see in the field. If we have vaccinated the birds, a lot of all the chickens in the 0 titer groups means that the birds have not received the vaccine. Hopefully, in this case, this is not the case, and the birds have received no vaccine. So we would say this would be normal in that case. And another measure that I prefer to see in the reports, I usually see it in the reports, but some labs they don't report it, is geometric mean titer. And the good thing about this geometric mean titer is essentially is that it eliminates the effect of outliers. If you have a set of samples with numbers, let's say 1, 2, and 9, and one sample with titer of 90, these are just examples. The mean would be 14. The average would be 14 in this case. The median would be 2, but the geometric mean titer would be 4.7, and this would be more reliable as compared to this one, because it essentially eliminated the effect of this outlier. So I would really prefer to see a geometric mean titer on a lab result. And with uniformity, which is demonstrated as a coefficient of variation. Again, these are we want to see very tight curves around the mean, but if the titers are too dispersed, or we have a bimodal type of dispersion, it will demonstrate that there have been a problem with vaccine or with the vaccination. So, as again, this is really overgeneralization, and really it depends on many factors, including the type of vaccine or type of pathogen we are talking about. But as a general rule of thumb, I would say this is would be more relevant to IBD, to Gumboro. With less than 30% would be excellent, 30 to 50 good, 51 to 80% fair, and more than 80% would be poor. But for this would not, I would say, again, as based on experience, this would not be good for IBV. For IBV, I would call, for example, a number with like below 70 or 80 would be good. Biocheck Lab has put together, or has defined another parameter, which they call it vaccination index, because the quality of vaccination is determined only by 2 factors, one of which is mean titer that we get from the lab, and then the CV that we receive from the lab. So if you divide mean titer by CV, they call this factor vaccination index, or VI. So high VI is indicative of good vaccination with high titer and low coefficient of variation, and low VI is indicative of poor vaccination, and above a certain limit indicates that there is probably an infection in the field. Disease that we usually use serology to monitor diseases are Newcastle disease, bronchitis, infectious postal disease, reovirus, inclusion body hepatitis, avian encephalomyelitis. What we use serology for monitoring and diagnosis in Canada, but in other countries, let's say, for example, in the US, where the disease is endemic, like with Mycoplasma gallisepticum or Mycoplasma synevia, in commercial settings, serology is also used for monitoring. In countries where avian influenza is endemic, let's say, for example, in Middle East or in Asia, they also use serology for monitoring of vaccination and diagnosing pathogen in the field for avian influenza in these countries. Georgia Poultry Lab, Georgia Poultry Laboratory Network, in cooperation with IDEX, has put together they are usually ask companies or large integrator to volunteer and send them samples anonymously, and every 2 years they put together samples and they create regional baselines, and they do it every 2 years. So they are on the website, you can find them. There are a collection of them. These are not optimal as actually, as you can guess, for Canada, but we don't have anything similar to this in Canada. So the reason it's not optimal is because they have different climates, different geography, even some of their vaccines are different. But considering the large number of the submissions to these labs and to establish these baselines still is a good baseline to compare our data to. And they do it for different types of the birds, breeders, layers, and broilers, for common diseases like NDV, bronchitis with IBD, and for Rio. And you can put your numbers side by side to this baseline and compare them to see how we are doing. Again, even when you look at these numbers year by year, even the number in the whole state are different. So I recommend, if you want to do that, to compare the data to multiple years. So with that, I really thank you for your time and attention. I had other slides as well, but as a result of shortage of time, I will stop here. But I will really thank you for your time and attention, and thanks CPC as well and Gigi for invitation. Thank you.
We thank you a lot, Kevin. That was a very thorough presentation. I especially love your slide about the data comparing the condensed and also the bronchitis serology. It's a great examples of showing how helpful serology is with our day-to-day investigation in poultry medicine. Thank you. And I didn't know that Georgia has a database for baseline too, so that's something that I would definitely look into. That would be very helpful.